Welcome back. With me now is the new CEO, the Chief Executive Officer of the Lanark Leeds and Grenville Addictions and Mental Health. And that individual happens to be Domenic Ielo.
That's right.
Was I close?
Yes, you got it right.
Yes, I got it. We were talking about his name just earlier. That's why I'm happy that I got it.
Yeah, thank you.
Domenic, you're fairly new to
Yes.
the job here, that being the CEO.
2 weeks in.
2 weeks in.
Yeah, 2 weeks and a bit.
Well, thank you for being brave enough to sit down with me. Some people won't until they've been in the job for months.
Oh, no, I don't mind. I don't mind.
Well, I appreciate that. So, why did you want to come to Brockville? Why did you want to be the CEO of Lanark Leeds and Grenville Addictions and Mental Health? Why?
Why? That's a good question. So so I'm a nurse. Excuse me. I'm a nurse by background.
Yes.
And in healthcare for close to 20 years. And slowly through my experience, I've grown to love mental health and focused on mental health. And the last job I came from was at the Royal Ottawa Hospital in charge of the schizophrenia and recovery program.
Yes.
I thought a CEO of a community mental health program is where to go to make a difference. And I've heard great things about this area and great work that the agency is doing. And I thought maybe I could go there and help.
Okay.
And make mental health and addictions care accessible for the community in this area. So that's really and it's really my true love in terms of getting help for people.
But you're bringing a wealth of experience with you.
Yes.
I mean, you in the past, it's not just what you have indicated to us.
Right.
You've got a list this long of different qualifications, correct?
Yes, I have a background in nursing, but in terms of where I managed geriatrics, medicine, acute care, some community programs, also professional practice. So professional practice is really bringing evidence and research into practice and ensuring that we are providing care that is best care. And then an informatics background as well, which is everything is going electronic, but the IT world doesn't necessarily understand what the clinicians and the clients want. So my role there was actually to translate that IT world.
You were the bridge.
I was the bridge. So I had some technical background, but the clinical background really helped in that.
I think we're very fortunate to have you come here with all these qualifications that you do have.
Thank you.
Now, I understand that you are bilingual, French and English?
French and English. My French is a little bit rusty, and hopefully I get that back in order.
I'm sure the community will help you,
yes, okay, thank you.
So, coming to Brockville, because you're from Ottawa, you live in Ottawa, so you're traveling. Do you think that eventually you'll move to this area?
Maybe. So I would like to at some point, but I can't promise that I will because I have two young daughters at home, and one is just in high school, and I think that wouldn't go over well.
That will not go over well at all.
No. So that's the main reason for not moving here at this point in time.
No. It's hard being a teenager.
It is.
You know, and then when your parents uproot you, that's even worse.
That's right. So I don't want to do that at this point.
Don't do that.
No. Okay.
Okay. No. So as the new CEO, you're coming in, and usually a CEO going into a company, they are bringing skills with them. They change things a little bit as far as how service or programs or whatever. What are you going to be focusing on when
coming here?
Yeah.
So the first couple of weeks, I've really been quite delighted by the work that the agency is doing, and I'm really proud of what they're doing already. I think the main thing that I'd like to do is not necessarily introduce new practices or new programs. It's really making the programs we have now more accessible. Currently, there's long wait lists for some of our programs, which is terrible. But I think working with our teams and looking at different modalities of providing care to increase the access for our clients. in the community. That's really what I want to focus on at the beginning, and working with our partners in providing that care. So making those connections with our community partners, with the different hospitals, different community agencies, not necessarily healthcare agencies, but even social type agencies that we could provide care together to our clients. So that's really the mandate I've been brought forward to do. And I'm hoping to do that with the team and working with the staff to make it a better place to work.
That's nice.
Yeah.
That's very nice. Yeah. So, is there still a stigma around mental health?
Yes, although the stigma is slowly reducing, there's still a strong stigma around mental health and accessing care. People still have difficulty with accessing care because they feel like if I go and access that care, people are going to think of me differently. But everyone has mental health issues at some point in their lives, and 1 in 5 people have some mental health issues. So everyone knows someone that has issues with mental health. The other facet of stigma is around people that have mental health issues in actually accessing like housing and different types of services because they're stigmatized against. And we need to reduce that. That's still probably a big point of contention and something that we really do need to reduce because these people need to live a normal life and we need to support them through that.
Yes, exactly. Yes. And welcome them into the community.
That's right. Yeah. Because they're a community member. Yeah.
They are.
Yeah.
Well, I shouldn't say they are. We all are.
Yeah, that's right.
We all are. Yeah. We all have issues at some point in our life, as you have stated.
That's right.
So why should you or I be stigmatized?
We shouldn't.
No, we shouldn't. No one should be.
Yeah.
No one. But it's one of those things. I think that it takes years and years to get rid of.
Yeah. It does, and we have some work to do. But but I've seen a big change since even starting in healthcare, which is
good.
Yeah.
That's
a
good
thing.
then.
Yeah.
Yes, good thing. As all mental health professionals, what is their greatest challenge?
Yeah. I'm going to go back to that stigma and talking about social determinants of health. That's like, and really what I'm talking about there is like access to funds, access to housing, access to food. Those are important things for anyone.
Of course, yes.
And if we don't have those things in place for a client, it's really difficult to get better. So a lot of our healthcare clinicians will work towards improving their mental health of their clients. But if they can't provide those basic needs to the clients, and it's not their job to provide those, but having access to those, it's really difficult to get that person on a road to recovery. So that's probably our biggest challenge as healthcare providers in regards to giving, in providing care to our clients. Yeah.
It's being able to get them to a point that they can start.
That's right. Yeah.
To realize, what the problem is and work with
if you imagine not having a house or somewhere to live.
That's pretty scary.
Right?
Yeah.
And you're trying to get better. If you don't have access to food, how do you get better?
Yeah.
It's really difficult.
I would think it would be.
Yeah.
Yeah. Okay, so what do you do for recreation when you're not in the office or you're not studying?
Yes. So I have a family. I have 2 daughters, like I previously said, and my wife. What we do right now in the winter, we're big skiers.
Oh, you are?
Yeah. So we downhill skiing. We have a membership at Pakenham, a season's pass for all of us, and we go there most weekends. And then we do a lot of snowshoeing, outdoor activities.
Oh, yeah, like the outdoors.
The outdoors is important to me and important to our family, and it's important to everyone.
Yes.
In the summer, we use the trails around our neighborhood to go biking in. So we go in the woods and so mountain biking and just road biking, and we do have a lot of fun doing that.
Good
and we have
for you.
Great neighbors next to us that we're great friends with, and we do that together. And we even do the skiing together, which is great.
Oh, you do?
Yeah,
that is nice.
It is really
That's
nice.
Yeah. Well, if you ever want to go cycling in this area, we have a lot of trails.
I might have to bring my bike.
You may have to.
I have a bike rack. So.
Bike rack. That's great. So, Domenic, good luck with
Yes.
your job, your new position.
Thank you so much for having me.
And will you come back and talk to us some more?
Yes, I'd like to come back, and I'd like to meet everyone in the community and as much as possible, and make sure you call the agency if you have any questions, and make sure you get help if you need it.
Yes.
And I'd like to come back, but I'd also like to some of my team members to come back to talk about the programs that we have, and sort of educate the community in the great work that they do.
If you don't mind, please.
Yes,
we would love to have
as much as you let us be here, and we'll be here. So
okay, appreciate that. So you and I will set that up then,
that's right.
won't we?
Thank you so much.
Thank you for coming in.